So shifting gears to Lyme disease, so this is a systemic infection by the spirochete Borrelia burgdorferi, and this is transmitted by the deer tick. It's the most common tick-borne illness in the U.S. There usually are more commonly seen cases in the summer. Interestingly, it has a bimodal age distribution. So you see it in the kind of 5 to 9-year-old and then later on in adulthood. Typically seen in the northeast predominantly, but also there's a cluster in the Great Lake regions. And what happens here is these Borrelia burgdorferi induce the chondrocytes to produce the matrix metalloproteinases. And the problem with those MMPs are that they degrade the cartilage, so they may contribute to cartilage damage, as we kind of earlier heard. The classic thing here is going to be the erythema migrans. That is a hallmark of this disease. And usually stage 1, where you see the rash, is about the first month after the tick bite. And in the first phase, you'll have sort of flu-like symptoms. Later on, as you get to stage 2, so this isn't everybody, this is about 1/5 of the untreated patients are going to go on to your disseminated stage 2. And these are going to consist of neurologic symptoms and carditis. Stage 3 may take months to years to develop, but this occurs in the majority of patients if they're untreated initially. And the predominant thing that you get is going to be arthritis of the knee, and the classic finding is going to be swelling that's disproportionate to the amount of tenderness. So they don't have a huge amount of pain, but they have a big effusion. The other skin finding that you can see later on is this sort of fine cigarette paper skin, the acrodermatitis chronica atropicans. And the study by Malusky looked at differentiating a septic arthritis from a Lyme arthritis and looked at these sort of 4 characteristics. So kids with a septic arthritis typically have a higher peripheral white blood cell count. They have a higher joint fluid cell count. They're more likely to be febrile, and they're more likely to not want to bear weight. So it's just a more extreme set of findings in terms of the physical exam than what you would see with a septic, or you'll see more extreme physical exam findings with your septic arthritis than you will with Lyme arthritis. So again, you have these sort of flu-like symptoms. One thing that is kind of a tip-off is if there's a cranial nerve 7 palsy, and this will be bilateral in this setting, and then acute joint pain. So this is just showing you the rash findings. So this bullseye rash that you get doesn't happen to everybody. About 3/4 of the patients that will have this, and this tells you what it is right away. And then that late stage, you can get that cigarette paper skin. So a 10-year-old boy is referred to your office for knee swelling. He was at camp in New York. He has full range of motion that's painless. The joint aspiration is sent for analysis, but what figure likely corresponds to the causative agent? So you're going to be looking for the spirochete here, and that is going to be figure D. Which of the following MRI images would best support a clinical diagnosis of Borrelia burgdorferi infection? So this is, here we're going to be probably looking for a lot of knee swelling, and we see one of these has a knee effusion here, and so that tips you off that the answer is going to be D. So labs, the white blood cell count may be mildly elevated. ESR and CRP are typically elevated. You can also test on the ELISA or Western blot. The ELISA is sensitive but not specific, so you want to confirm that with the Western blot. And then if they have the neurologic symptoms, then they may get a tap of the CSF, and that typically shows increased protein and pleocytosis. The joint aspiration, so you're going to see this big effusion and you're going to aspirate it, but this is where you see a lower typical cell count, as Malusky saw in his study. The range is generally around 10 to 25,000. And then you can do a skin biopsy culture as well. The features, again, we're sort of beating this to death, but it's relevant both clinically and on tests. So things to differentiate this from your septic arthritis are your ability to bear weight, normal white blood cell count, and a lower synovial count. And there's going to be a little bit of overlap in some gray cases, but it's something to think about if you're not growing out an organism and it was sort of a mild presentation. So a 13-year-old presents to the ER in Rhode Island with knee pain for 3 days that was atraumatic in onset. He's noted to have a tense, swollen knee. An oral course of antibiotics is selected as definitive management. So what antibiotic would be the most appropriate for this patient, and what is its primary mechanism of action? So we've got doxycycline and whether or not that acts on the 50S ribosomal subunit or the 30S, cephalexin, and where that acts on wall synthesis or folic acid, and rifampin as your answer options. And again, here, there's this rash, so we know that what we're dealing with is Lyme disease, and you're going to treat that in a 13-year-old with doxycycline, which inhibits a 30S ribosomal subunit. So oral antibiotics is the treatment of choice if it's a mild disease, and typically for adolescents or those in the adult range, this is going to be with doxycycline, but you don't want to give it to young kids. So if the pediatric population that you're treating this in is less than 8, for the less than 8-year-olds, they're going to get amoxicillin and cefuroxime. If it was not responding to the oral antibiotics, then you can move on to IV antibiotics. Typically, this would be used if there's neurologic involvement or more severe presentation. Synovectomy, so this can be used if it's not responding to the antibiotics, even with the IV form, but more commonly what you're going to do when you're operating on Lyme disease is that it was a gray picture and you're not really sure if it's a septic arthritis or an arthritis related to the Lyme disease, and so you IND it to be on the safe side while you're waiting for confirmatory studies. Complications, fortunately, chronic arthritis is rare.
Be sure to subscribe for more content and follow us on Facebook and Twitter at Orthobullets.